Thank you very much for so kind introduction. Good afternoon, ladies and gentlemen. First of all, I would like to thank very much the university for inviting me to this conference, and I'm in particular thinking to my colleague, Professor Nguyen, who actually advised us to come, and I'm very happy to be here for the first time. Okay, so I think that I'm very impressed to listen to the first presentation from our colleague from Institute of Animal Science, actually INRI, as International Livestock Research Institute, part of the CGIAR system. So we work mostly to improve food security in the global south. And with the development of China, like you show a very impressive livestock development system, I think that China can do a lot of things for many countries that we are working on, in particular in Africa. So in the next 10, 15 or 20 minutes or so, I just want to share with you some experience on One Health approach. And I will finish by actually giving some reflection. I don't know how it moves this slide. Okay, so it's here. So I will talk a bit about the One Health approach, followed by some experience how to operationalize this rather popular approach, and having some reflection on how digital technologies and AI application can be done with the One Health approach. And I have to say that I'm not an expert in AI or digital technology at all. So I actually pulled together some of the experience from our colleagues working in our institute in that area and some conclusions. So the first question I want to ask you, so now how many people in this room have heard about One Health approach or have worked on One Health? Okay, I found only 4 or 5, maybe you are shy. So let's say that not many people have really worked or have experience on that. Okay, just to bring you a little bit in the context, I created, he mentioned about 26 floors pig production farm in China. So this go around the world. But the raising demand of animal source food is important. So we produce more and more animal source food, including egg, milk, and meat for the next decades. And the demand of poultry, for example, can go to 350% compared to 2005. And some of the other meat, for example, in particular pork and beef, in so very raising rapidly. So the food production, in particular animal agriculture, is very important in that sense. So when you produce more, obviously you will face the problem of health, in particular animal health for our herd. And here you can see here some data, not very new, but from VOA, former OIE, showing all this major disease outbreak in our world. You can recognize some of the key diseases like foot mouth diseases, CSF. Recently, African swine fever, make a lot of people headache, in particular China and also my own country, Vietnam, where we produce and eat a lot of pork. Imagine that in the globe, I don't know how many colleagues from America here, per capita, they eat something than more 100 kilograms of meat a year. Whereas in some of the lower income, middle income countries, it's even less than 10 kilograms, like in the case of Nigeria. Vietnamese eat something like 30 kilograms of pork a year, and Chinese number, I believe that is much higher. So the key point here is, in fact, the problem of disease will be, or has been all the way very important, because it caused a lot of significant loss in terms of economic impact in our world. Now let me bring you a little bit more in the perspective of global health linked to livestock. So that is because we talked about this approach One Health I mentioned before. I think we have many things. When we talked about livestock agriculture, we talked about gas emission, climate change, air pollution. You can talk about the loss of biodiversity and so on and so forth. But linked directly to global health, I would say that 3 key things that we are talking about. The first one is about zoonotic diseases and infectious diseases. We observe in the last 2 or 3 decades the increased frequencies of new emerging infectious diseases in our world. You have, of course, COVID, you have Ebola, you have re-emerging disease, you have SARS, and so on. Here in this Asia, we are in region, we have a lot of things coming from here, even influenza, SARS, COVID come from this area. So, and most of these diseases, unfortunately, come from animals, the so-called zoonotic diseases. The first one. The second one is about antimicrobial resistance. It's very much a hot topic now because it's killing about 1.2 million people a year, according to the Lancet report. And this continue doing, and it's linked to people, animal, and the environment. And the third one is about foodborne diseases or the food safety. Food safety causes equivalent of global of disease, the so-called DALI, equivalent to HIV/AIDS, malaria, and tuberculosis. But the investment to this problem is really minimum. It costs a lot, something like $150 billion globally, and most of the burden come from actually low and middle income countries. So when we talked about this complex health issue like zoonotic diseases, AMR, and foodborne diseases, we cannot use a classic approach. We need a more innovative and integrated approach, bringing different sectors to work together, and that is basically the One Health approach we talked about. Here is the revised definition of the One Health high-level expert panel, OLEP. So this is a group of experts set up by the quadripartite. I will show the next photo. And actually, I'm part of this group together with two other Chinese, because you are Chinese here, most of the Chinese. We have Professor Fang Jing from Medical University of Kunming, and from we have Xiaodong Zhou. He is actually professor from Shanghai Jiao Tong University. He used to be director of parasitic CDC lab over there. And the One Health approach, so this is not new. And the people practice this for many years, I would say for 50, 60 years, but without talking much about that. And only because of COVID in particular, that approach become very popular because it deals with zoonotic diseases. And here you can see the definition as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animal, and the ecosystem. So here, we are not talking about three different healths separately. We talked about one unified health. That's why we call it One Health, but not three health. So it's basically, there are a few characteristics, but for me, the most important is, in fact, this approach recognizes the very close interaction between our health of people, animal, and the environment. So everything is interconnected. As we know, it's a system approach. The second is, in fact, to solve this complex health issue, we need to mobilize different people. So this is very simple, but by human nature, it's not very good. Because if I'm in one discipline, I think that I'm good, and so I don't want to work with other people. But in reality, actually, to solve the complex problem, we all have to work together. And here, for the approach of One Health, we need to bring people working from MARA, Ministry of Agriculture in China, for example, where we have a lot of people working on animal health. We have people from Ministry of Public Health, so medical people, public health people, and of course the environment, because it's linked to the wildlife, pollution, and so on. So this is really, basically recognize interaction between animal people and the environment, and bringing people to work together to solve this problem. Traditionally, this approach talked very much about zoonotic diseases. But now, because it's become popular, people associate to many things to really mobilize different people to work together. And that's why here, we reflect a little bit the One Health approach now, which is the own concept of China. And I think that here is one of the papers by our colleague Xiaodong Zhou from Shanghai, refer to actually, the relationship of people and environment in the own concept of China, 2005, 2599 BC. We already recognize this kind of concept very much in own China, in the own time. And afterwards, the American Canvin Trabe was working in Sudan, bringing different people together in the pastoralist area. And basically the point is to talk about one medicine. If you study human medicine and vet, actually, for example, basically there's no big difference in the medicines that we are doing between human and people. And from that, we move from one medicine to One Health that we are talking today. And varying from one discipline to another, people have different understanding about One Health. For example, here medical vision, people talking more about, bacteria, virus, parasite, diseases, etc. Whereas, people working more on the global visions, they talk now about planetary health. There's a competition between One Health and planetary health set up by Lancet, if you read this kind of thing. But for me, it's not really important that we need to bring people together, and that's why the agri-food system vision of One Health, we talk more about animal health, agro-ecosystem health, even soil health and plant health. All these things part of our One Health concept. It's not about health of people, animal, but also soil health, ecosystem health, plant health. We actually in China, we use a lot of antibiotics also for crop. You see, so this is not a problem of livestock, aquaculture, or people. It's also the plant health that we are talking about. And finally, the food system is also very important, because we talked about from production into the consumption, and along the chain of food system, we talked about diseases, and actually it's very close to One Health. I just want to finish by saying that, because it's become quite popular, the 4 organizations of the UN, actually 3, you have here FAO, WHO, and UNEP, together with one organization of animal health, set up this quadripartite organization to moderate a little bit at global level who's doing what and how to operationalize this One Health agenda. And you have all this document from the country level, how to implement that. And they have set 6 action tracks. And the talk we talk today is very much linked to the reducing the emerging and re-emerging zoonotic diseases and tropical neglected diseases, and also AMR. So all these things is the online things. Okay, so for my own institute, actually we set up an agenda for One Health. I had the pleasure to lead this group for the last 5 years in Kenya, Nairobi. So actually the entry point of International Livestock Research Institute in the global agenda of One Health is really with livestock, because we work on livestock. So actually livestock can be livestock that we are talking about here, but you have also the aspect of wildlife in the nature. It can cause also a problem, and we want to work on the pandemics issue, on foodborne diseases issue, endemic zoonosis, and antimicrobial resistance. We do research, but we do also intervention. For example, here, a typical research we do in One Health, we set the research priority. For example, here we work on zoonotic diseases, food safety, AMR. We take care also of water from the environment, but don't forget that we need to understand the behavior and the governance of different structure to make One Health operationalized. So we do research, we generate evidence, but we also develop innovation to reduce the risk of zoonotic diseases, food safety, AMR, for example, and we try to integrate this innovation in the national program so that we can scale up for many million people. So this kind of research we are doing for research for development. We call that this type of research. It's not basic research. Now, moving to the role of digital the technology in AI and One Health, it's quite timely because we have a paper accepted this week, and that's why it's been in the proof things. So we organized 2 years ago in Australia at ISVI. ISVI is a forum for epidemiology and animal health economics, and we discussed a bit, how ICT and AI can be playing a role in the One Health things. So basically, I try to summarize a little bit what we discussed in this paper, and we realized that actually in the context of infectious diseases linked to livestock and even One Health people, I think that the AI and digital technology give us a lot of opportunities to really inform how we detect, we predict, and we respond to livestock disease threat in our world. And the more you have the large livestock skin problem, if the biosecurity is not good, you wouldn't come up with a lot of problem. And in the same time, where we work with smallholder in Africa and in Vietnam, in Laos, and Cambodia, they don't have a very good biosecurity system. And that is also another side of the problem, that disease can be spread very widely if you don't control it in a nice way. So there's a few things. So the first time, it offers the opportunity to have a real-time data that allows actually early warning to know where outbreak is, and actually we have enough time or early response to this type of outbreak. A lot of things around AI and machine learning can help us also to identify the patterns that we couldn't see before, because we could not collect a lot of data, and it looked like that the machine learning can generate a lot of data to contribute to the prediction of the diseases. We talked a lot about a lot of apps now. Everyone have, or most of people have this mobile phone, and actually it's the use of different platforms to have the surveillance in the last mile is so important, and it can be realistic even for the farmer in a quite remote area in some of the country if they have mobile and internet. And finally, is the climate and disease models can be also integrated in the forecast risk zone. So that is actually I see that as the kind of key things that we can use the digital technology and AI in the context of disease prevention we are talking about. I just want to give an example here. It's not our example. It is actually our example from Thailand. Our colleague from Chiang Mai University, not far from Nguyen, Kunming actually, they developed the so-called participatory One Health digital disease detection, PODD or POD. And the whole idea of that is basically to bring some of the app and get the support from the local government, the NG over there, using the digital system with the PODD volunteers to detect disease in the community and actually to have time to respond to that. So I see that she told me that I have only 2 or 3 more minutes. And actually, when the app is now is not very expensive or not difficult to do. Many companies can help us to do the app. Just the concept, we develop the app, but the important is in fact we get enough people in the community to get in and use this app with the support of enabling environment. They started with 75 pilot government, and now they come up with 4,000 at the commune level. So this is a lot of people using the app at the moment. And just highlight that here, if you look at the time to detect early the diseases, only 45% of the outbreak was informed or detected from 1 to 3 days instead of, several days, weeks and months before in the community. So that helped a lot if the community want to do that in developing countries. We developed another app here in the case of Vietnam with support from Korea, and we use the farm vet care. And so basically, this app concept is really to collect data from the farm, but also, helping the animal health worker to respond and the government from the provincial level and national to support the farmer when they have problem to treat the disease. And basically, this morning is very timely. I had the opportunity to visit this Yuku Poultry Farm. This morning, I went to this one. And I told to our colleagues that I will put some photo here. And actually, the AI and digital technology are very massively used here, 20 kilometers from the room here, by having, a lot of data from users, coming up also with the disease diagnostic and help the farmer to treat themselves. They show me the online data, and at that time, it's about 250,000 farmers using the app actively. So, when we talked about blockchain and AI, etc., that is a huge database that the company can use to actually process and have more information from the farmers. So I think that is very nice in the context of China. So this is really very fresh visit I had this morning. The third example is about, emerging infectious disease. So here I take the example of Rift Valley fever in Africa. It's re-emerging, and Europeans are concerned about that. That's why they fund some research program to really prevent from the spread of disease in Africa to Europe, for example. That is a disease from ruminant to people, if you are not a vet, and actually re-emerging. And our colleagues actually collect data with the government structure, the climate data, the livestock data, actually, and process it and to predict when the outbreak would happen so that, they can come up with the strategy, for example, here, the decision support, to advise the government to vaccinate their herd so that they can prevent disease from animal to people. So that is actually also another example from that thing. I want to finish now by saying that, the One Health approach is a very popular and important approach. We talked a lot, but finally we need resource and people and capacity to operationalize it on the ground. And actually, there is a lot of data showing that the return rate of investment at One Health is quite interesting, 3 to 1. I see my chief scientist, Sandra from CGIAR, showing a report, $1 you invest in agriculture, you can have $10 back. In this disease area, World Bank shows that you invest 1, you got 2. And if you have a pandemic like actually COVID, you have to spend basically, 31 billion annually to manage the pandemic if it happens. So better to put $1 to prevent the next pandemic, and we can save 31 billion US dollar. And basically the concept of One Health to mobilize the resource of national and also international community to prevent the next pandemics in our world. And I think that, with that, I just want to finish to repeat this slide that you might see from Sandra yesterday in the plenary. The CGIAR system is the next 5 or 6 years. This is basically the skeleton of our research. We have 12 science and accelerator program. And when you talk about AI and digital technology, you have one actually accelerator called digital transformation. Now the third one on the left, working on this to transform food system globally, in particular with our colleague here in China and many countries. And within 12 programs we have the sustainable animal and aquatic food. This is topic of livestock today. And we have also the One Health component to address the One Health approach within the production that we are working on. So finally, I just want to say that we have a lot of challenges. The concept is nice, but implement the AI and digital technology, it can be challenging for some of the area. In particular, when we are working in CGIAR, you need enough mobile phone and internet to use that. So infrastructure. You need to policy to support the enabling environment to make it. The data governance is also an issue, and also the inequality in access to the digital tools among province, people, etc., and sustainable financing and trust. And actually, that is the topics that we talked some time ago with FAO to form a FAO community practice for on ICT and One Health that I had also the pleasure to participate. Okay, to really conclude, what should we take home from this presentation? I think that the One Health approach is really an important approach to address the complex health issue. That's why we don't talk about tree health, but we have talked about unique health, the health of animal, people, and the environment all together. We need to improve together. To implement One Health, we need a stronger cross-collaboration sectors. So that's why I said people from Ministry of Health, Environment, and Agriculture have to work together. And also the digital solution and AI can help us and to give a lot of opportunities to have an early warning system to predict it and to manage in our livestock and wildlife context. But the challenge remains for applying these technologies, varying very much from one country to another, from one context to another, and that we need to really tailor the technology to the local context to make it work. So with that, I would like to thank you very much for the attention. Thank you.